Our next speaker is Brett Schaefer, who joins us from the Heritage Foundation's Margaret Thatcher Center for Freedom, where he holds the post of J. Kingham Senior Research Fellow in International Regulatory Affairs and has written extensively on the WHO and the current pandemic treaty negotiations.
Thank you very much, Congressman Smith, for the invitation to speak here today on the draft WHO pandemic agreement. We're all familiar with the failure of the international health system to respond to COVID-19. China failed to inform the international community of the outbreak in a timely manner. China mischaracterized COVID-19, saying that there was no evidence of human-to-human transmission, which the WHO parroted unquestioningly. China did not expeditiously share genomic data about the disease and did not allow prompt, unconditional access to an international team of health experts. China shut down internal travel while allowing international travel, contributing to the spread of the disease. All of this resulted in millions of deaths and trillions in economic harm. At a minimum, you would expect a new pandemic treaty to address these fundamental flaws and failures that were revealed during COVID-19. The current draft does no such thing. Instead, the draft agreement focuses on curtailing speech, as some people have noted here, mandating resource transfers, weakening intellectual property rights, mandating technology sharing, pushing redistribution of manufacturing and production, and empowering the WHO. Specifically, despite the recent failings as revealed under COVID-19, the draft places the WHO at the center of a future pandemic response system through its proposed pathogen access and benefit sharing system, and empowers it to claim and redistribute a minimum of 20% of pandemic-related products for equitable distribution through a proposed global supply chain logistics network. These new authorities must be funded, so the draft obligates parties to provide financial resources, both mandatory and voluntary. While the draft provides no specific cost estimates for these expenses, they could easily cost U.S. taxpayers hundreds of millions of dollars, even billions of dollars annually. The draft would require parties to support time-bound waivers to intellectual property and use WHO TRIPS provisions to override intellectual property rights, which will curtail future investment in health research, which is exactly the opposite you would want to respond effectively to a future pandemic. Much of the draft focuses on providing special treatment for developing countries, including financial support and policies designed to promote research collaboration. While there are reasons to support these types of activities to help developing countries bolster their health systems, these efforts should be voluntary, not obligatory through a treaty. In addition, because the UN considers China to be a developing country, they will benefit from special treatment and access to proprietary technology and know-how under the terms of the treaty. These are intended to help low-income countries, not the second largest economy in the world, leaving aside also China's history as the world's most preeminent thief of intellectual property. So to put a cherry on top, the treaty also prohibits reservations, which are the primary way for the Senate to express how it interprets specific elements of the agreements that come under it for advice and consent, and where its reservations and declarations are applied, which parts of the treaty does the U.S. consider binding and which ones doesn't it consider binding? So presenting a document to the Senate and prohibiting reservations, understandings, and declarations is an affront to the constitutional process for the U.S. System here. Quite simply, the draft pandemic agreement falls short in nearly every regard. As mentioned by Ambassador Bremberg, if this treaty were in place, there's nothing, no provision inside of it that would have prevented or addressed the failings that were talked about at the beginning. China's failures to share information, China's failures to be forthright, transparent, and honest, China's failure to curtail travel externally as well as internally. All of these things were not going to be addressed in this pandemic agreement. Instead, we have an agreement that focuses on other priorities that would not have addressed those flaws. I have a paper here that was published this morning by a colleague of mine and Steve Groves at the Heritage Foundation and myself. There are some copies here. It's also available at heritage.org, and it goes into much greater detail about the issues that I've raised here. So thank you very much, and I look forward to questions.